Today we're going to be talking about aerosol medication for asthmatic patients. We are going to go over the indications, contraindications, precautions and slash or possible complications, assessments of needs, monitoring, medication agents, before and after x-rays, and common treatment modalities. Before we get into all this, I'm going to tell you about asthma. Asthma is a condition in which a person's airways become inflamed, narrow, and swollen, and produce extra mucus, which makes it difficult for them to breathe. The main medications we are going to be talking about is adrenergic bronchodilators, such as albuterol. The general indication for adrenergic bronchodilators is the presence of reversible airflow obstruction. Adrenergic bronchodilators improve flow rates in asthma, acute and chronic bronchitis, emphysema, bronchiectasis, cystic fibrosis, and other obstructive airways. Contraindications: desaturation resulting from mismatching of V/Q with inhalation of aerosol is not clinically significant and reverse quickly. The implications of beta-2 adrenergic agonists in deaths from asthma, termed asthma paradox, or the beta agonist controversy, remains debated. There is evidence of loss of bronchoprotective effect with the use of beta agonists, and patients should be cautioned to avoid asthma triggers. Precautions and slash or possible complications is dizziness, hypokalemia, loss of bronchoprotection, nausea, tolerance, and worsening ventilation slash perfusion ratio.
Now we're talking about assessment of needs and monitoring. Assessment of therapy with adrenergic bronchodilators should be based on the indication of aerosol agents, presence of reversible airflow obstruction owing to primary bronchospasm or other obstruction secondary to an inflammatory response or secretions, either acute or chronic. Basic vital signs should be assessed before and after treatment, especially for initial drug use, and the patient subjective reaction. Patients should be instructed in the correct use of the aerosol device, with medication of correct use. Finally, the patient's subjective reaction to the treatment should be monitored for any changes in breathing effort. Monitoring. Monitor flow rates using bedside peak flow meters, portable spirometry, or laboratory reports of pulmonary function before and after bronchodilator studies to assess reversibility or airflow obstruction.
And I'll be talking about medication agents and then showing you x-rays of before and after the use of medication. Albuterol, the brand names are Proventil HFA, Ventolin HFA, ProAir HFA, Acunev, and Vospare ER. The receptor preference is beta 2. The dosage for albuterol is 2.5 mg or 0.5 ml. The time courses are onset is 15 minutes, peak is 30 to 60 minutes, and duration is 5 to 12 hours. Albuterol is used to treat wheezing and SOB caused by breathing problems such as asthma. Albuterol belongs to a class of drugs known as bronchodilators. It works by relaxing and opening air passages to the lungs to make breathing easier. This is a before and after x-ray. This is the before, this is the after. They get the treatment of albuterol. Today our patient came in complaining of SOB. The patient was having a mild asthma attack. He was using his accessory muscles in order to help him breathe. We assessed and listened to his breath sounds, and he was wheezing on inspiratory and expiratory. So for the wheezing and SOB, we gave him albuterol 2.5 mg so that his airways would open up and make it easier for him to breathe.
Hi, Mr. Salazar. I'm Alex. I'm a respiratory therapist student. I'm here to give you your breathing treatment and check your vital signs. I am giving him albuterol 2.5. Make sure you take slow, deep breaths, okay? I'm gonna see your finger.
His respiratory rate's 30.
And I'm gonna check your pulse. So his heart rate is 120. His respiratory rate is 30. His SpO2 is 92. His heart rate is high because he is having an asthma attack and he's breathing very fast. His respiratory rate is high because he is having anxiety.
And before and after the treatment, his x-rays would have looked somewhat like this before, and then after this, after the respiratory therapist giving albuterol to the patient.